Hello everybody, so today I'll be teaching you how to put on PPE and how to wash dentures. So right now I'm just going in with the gown. And then the pre-procedure for this will be knocking, entering, addressing the patient by name or the resident by name. Then you want to introduce yourself, say, "Hi, Mr. Smith, my name is Janaya. I am your CNA for today, and I'll be providing your care, whatever your care that you will be providing, because I'm only putting on PPE, so yeah." Then you want to always check their wristband or identification before you start. So like I said, this is just me putting on a gown first. Always make sure you tie it tight in the back. So this is the gown once it's on. Next, I'm going to go in with the gloves. You always want to make sure that the gloves are covering the cuff of your gown, like I'm showing you here, just so you don't risk getting exposed or anything. And after that, you just put on a mask. I like to pinch the nose so it's secure. And yeah, here goes. Now for taking off PPE, you want to go in on the inside of the gloves to make sure that you don't touch yourself. So that's what I'm doing here. And then you dispose of that. And then you're going to take your mask off. And then you're going to untie your gown. When taking off your gown, you always want to go from the inside so that you don't risk contamination. And that's what I'm doing here. And I'm balling it up from the inside too. And then you just dispose of all of that. And yeah. Post-procedure for this is always washing your hands. And then you just want to ask them, are they okay? Do they need anything? And yeah. You also always want to make sure that you're comfortable in your bed. And then you always tell them when you're going to be back. So yeah. So next is denture care. You always want to start with hand washing. That's what I'm doing now before I put on the gloves. Pre-procedure is you want to knock on the door, address the person by name, and then introduce yourself by name and title. So, "Hi, I'm Janaya. I'm your CNA today. I'll be taking out your dentures and cleaning them for you." That's me explaining the procedure, and then you go on about your procedure. And then don't forget to always identify the person and check their wristband. And yeah. So for denture care, once you take the dentures out, you want to put them in a kidney basin, and then once you take them to the sink, you want to put a towel at the bottom of the sink. That's just to prevent any damage to the dentures if they fall in the water or anything. And then you also want to make sure the water is warm to cool, not hot, because it could damage the dentures. So never hot water, just use warm to cool water. And then you let the sink fill up about halfway, and then you rinse them off one by one. So that's what I'm doing here. And then you turn the water off. And then you're going to go in with your toothbrush and just pretend that this is denture cleaner. You don't want to use regular toothpaste. Or you use what's instructed on the denture care plan. So this is just me going in, washing them. You just brush them like you would brush teeth. Make sure you do it outside, back and forth, and then the inside is kind of an upward motion, then the surface of it is back and forth as well. So that's what I'm doing here. And then once you get done, you want to rinse it off, and then you do the same to the other pair, denture cleaner, and you back and forth just like you brush your teeth. That's the back of the teeth, and then the surface of the teeth. And you rinse it off, warm and cool water only, and then yeah, you're done. Post-procedure would be, of course, hand washing, providing comfort. You want to drain the sink, let out the towel, rinse the brushes, clean and dry all the equipment that you use, and return it to the proper place. And then you discard of disposable items that you use during the process. And yeah.